In this video, we are going to explain three important aspects of hexagenous reflexology. First, we talk about using the circular clock to represent the cross-section. How the two circular clocks intersect to represent the body cross-section. Then how the four ellipses intersect to represent the main body. And finally, how the four ellipses are mapped into the position of all the organs. Okay, please see the following videos.
Now, this is the circular clock. The odd hour is marked with bold line, and the even hour is marked with the thin line. These are two circular clock on the screen. On our right side is the normal clock. Represent the left end of the patient. The hour indicator is run in clockwise direction, but at our left side is its mirror. The hour indication is run in the anti-clockwise direction. This is important, as our body is symmetric in many ways, so the two clocks also should be symmetric in nature. Now, this is the body section at the thorax section. As you can see, the lung, the heart, the rib and spinal cord. At both sides is the cross section of the hand. Right side of the screen is the left hand of the patient. The clock run in clockwise direction. Left side of the screen. The clock hour arranged in anti-clockwise direction. Remember this well, as it is important to our future lecture. Now, we intersect the two clock in a specific way. As you can see, the intersection is at 11 o'clock at top and 7 o'clock at the bottom. This gives you some idealized cross-section of the body. Now, we superimposed it into the thorax cross-section. As you can see, it fits well into the picture. What is important is the position of the clock line. As you can see, the hour line of 1 o'clock, 3 o'clock and 5 o'clock are external. The line 7 o'clock, 9 o'clock and 11 o'clock are the inside area of the intersection. As you will see in the future teaching, when you draw the hour line along the main body, they covered almost all the acupuncture points. So when you study acupuncture, these hour lines is important. In gynotherapy, we do teach acupuncture in the advanced teaching, but we do not use the meridian and the acupuncture points as in the traditional training. We use the hour line and the intersected area of the four ellipses, which we shall explain as follow. Now, this is the intersections of four ellipses. It represent the idealized body trunk. The top part of the four ellipses look like the chest area of the body. The middle part slim down like the waist. The lower part look like the pelvic or lower abdomen. Then we draw four horizontal lines. The lines touches on top and bottoms of the ellipse. This divided the ellipse into three equal parts. The top portion cover the chest area of the body. We call it the thorax section. The middle portion cover the abdomen. We call it the abdomen section. The bottom one cover the pelvic area. We call it the pelvic zone. In the thorax section, there is three intersection area. We always name the symmetric section as in a pair. So we name the left and right section as T1 and T2 respectively. T for thorax. The abdomen area consisted of 7 intersections. A1, A2, A3, A4, A5, A6, and the central one A7. Coming to the pelvic section, we named the intersection as P1, P2, and P3. Looking at the abdomen section, the intersections look like two big eye. We always nickname it the eye. Actually, when we study the reflexology on the face, when we map the four ellipses on the face, this area do reflex to the eye. Now, this is the drawing of the front body with organs. We superimpose the four ellipses on the body. As you see, they match very well. You may feel the upper part of the body is bigger than the top two ellipses. But actually it is not. This is due to the muscle at the back of the body. When focus only on the front muscle, it fixed well. Look at the thorax area. It covered lung and heart. As you can see, the lungs are situated in T1 and T3. Heart is at center. At T3, at the abdomen section. Many important organs are in this sections. The liver, stomach, kidney, spleen, pancreas and etc. The spleen and pancreas are covered by the stomach, and kidney is at the back, which we shall show it later. In general, the diaphragm is at the top center of the section. The liver is at the left, means actually the right side of the patient. We talk about the side from observer. When come to the patient, the side is reverse, left become right. The stomach is at right. The position of the big intestine or the colon, mainly at the left P1 and right P2 sides of the intersection. The horizontal part of colon can be seen at the bottom of abdomen section. You should study this diagram until you can visualize the position of the organs. Then come the basic application. There are a few basic rules in the mapping of reflexology. First is the opposite mapping. T1 of thorax is reflected to P1 of pelvic. T3 to P3. Then you know, lung is reflected to large intestine or colon. Anything wrong with the lung will affect the colon. And vice versa. Problem in colon can reflect to the lung. There is one testimony that a member is suffering of asthma, the lung problem, but later is diagnosed having colon cancer. After going through the gynotherapy, when the asthma become well, the cancer also disappeared. We proceed further, and you can see the heart in T3 is reflected to the small intestine in P3. For the abdomen section, the reflection is from left to right, or from right to left, front to back, and etc. So liver and gallbladder, stomach and pancreas, kidney and bladder are associated. This is the superimposed of four ellipse on the organs, without the body part. Today we only give some brief introduction. In future when we discuss about the organ system, we shall discuss in more details. Now, before that we use male body to represent the four ellipse. Now we look at the mapping on the woman's body. As you can see, it also match well. Look at the back of the body. I think you can see it clearly now. Kidney is inside the eye. The rest of the organs I leave it to you to identify it. I shall upload all the main photos in the social media, so that you can download it and study it carefully.
So now you understand how we map the four ellipses into the body to understand the position of the organs. In the next video, okay, I'm going to talk about how we map the four ellipses on the face, on the limbs, on the leg, and how your face, your limbs can link to the organs in the body. That is quite interesting. Okay, see you in the next video. Thank you very much. Bye bye.